The Senate Finance Committee is holding a hearing to consider the nomination of Mehmet Oz, widely known perhaps to you as home as Dr. Oz, to be the administrator of the Centers for Medicare and Medicaid Services. Let's take a listen.
Our young, our disabled, and our elderly. For me, this commitment has been a lifelong passion. My physician father, when he came here, when he immigrated, saw America as a beacon of hope, a land of opportunity where everyone's decisions mattered. That imbued in me a confidence that I mattered, that I had agency. For example, I was a student athlete at Harvard, Center Wyden like you. That was the original Make America Healthy Again concept, that you just would work hard, play hard, eat well, and watch your body thrive. But because of my experience in college, I was surprised when I matriculated at the University of Pennsylvania in medical school that there was no nutrition class. So because I thought I had agency, I ran for school president, I won, and I created that class. I became, as well, a student at the Wharton Business School, and while there, I learned the skills necessary to manage large organizations like at CMS, where we have nearly 7,000 folks, hardworking career civil servants, and 40,000 outside contractors involved with the delivery of our services. Next, I began my career at Columbia University. And for those of you who don't know where Columbia, the medical school is, it's in uptown Manhattan in an area called Spanish Harlem. At the time I was training, it was the murder capital of the world, an area heavily populated by Medicaid patients. And I saw firsthand how our services, our healthcare system, underserved these communities. So I went to work. I began developing high-tech solutions, life-saving medical breakthroughs, ranging from mechanical hearts to the mitral clip, which is a small device you can put into the heart without stopping the heart that fixes heart valves, and it saves lives. In one large study, 50% reduction in death at half the price. Those are the kinds of advances that I wanted to be involved in. But I also pushed for low-tech solutions, like getting my patients to use preventive strategies, healthier lifestyles in order to recover from the heart surgery that I was often performing on them. And then Lisa, my wife, and I started HealthCore, which is a teen foundation which has touched the lives of millions of Americans over the last 20 years. Senator Bennett working in schools, which you discussed in your office, tirelessly trying to get young, energetic kids to play a role, college graduates, in the well-being of kids just a few years younger than teenagers. And all along, I was working hard to publish what I found. In fact, publishing hundreds of peer-reviewed academic articles in some of our top journals, a bunch of New York Times best-selling books, as Senator Grapo mentioned, and all of these culminated in the creation of the Dr. Oz Show. We hosted health advocates from all walks of life, and we did it well, which is why we won 10 Emmy Awards for outstanding work over the 13 years of the program. I share my story with you for a simple reason, to highlight that everything I have done in my life, educationally and professionally, has prepared me for this precise moment in time, which I believe offers a monumental opportunity and a challenge for us at CMS.
Well, you're looking at Dr. Mehmet Oz. He's up on the Capitol Hill today in front of senators for his confirmation to head Medicare and Medicaid Services. Last time we probably saw him was when he was running for Senate in Pennsylvania. We're going to take a quick break, but we'll have more after this.
You're watching Scripps News, part of the Scripps News Group.
Well, happening right now, a busy day in the Senate. They're expected to vote on a bill to fund the government. But before that, right now, the Senate Finance Committee is holding a hearing to consider the nomination of Mehmet Oz to be the administrator for the Centers of Medicare and Medicaid Services. This is him delivering his opening statement. Let's take a listen.
Real-time information while they're taking care of patients and within their workflow. Artificial intelligence, I believe, can help. It can liberate doctors and nurses from all the paperwork, which, by the way, is as much time they spend on paperwork as taking care of patients. They should focus on patients as better use of their time. And third, let's be aggressive in modernizing our tools to reduce fraud, waste, and abuse. This will stop unscrupulous people from stealing from vulnerable Americans and extend the life of the Medicare Trust Fund. I ask your permission to start sprinting after these goals, so together we can provide access to better care, deliver better outcomes, and make America healthy again. I look forward to your questions, and I pray for your support. Thank you, sir.
Thank you, Dr. Oz. As I mentioned in my opening statement, your background and experiences bring a fresh perspective to the role of CMS administrator. As an accomplished physician, you have firsthand experience not only with the bureaucratic nature of federal government payment programs, but also the impact of chronic disease, as you've discussed in your statement. I'd be curious if you would just expand a little more on your vision for CMS and how you would integrate nutrition and lifestyle-based interventions into our healthcare system.
Senator Grapo, when I walked into your office, you gave me an Idaho potato chip. You also gave me a large potato, but that's where those potato chips came from, and nothing else was added. If you look at the ingredient list, it was a potato and a little bit of salt. You also had yogurt in your office, which was low-fat, flavored, and I would argue not as healthy. The average American has a difficult time making that choice, and we'll often incentivize products that aren't as healthy for the American people, which is confusing. One of the points that I mentioned at the end of my opening comment was that if we gave people in their hands tools, resources that are useful, not information, but tactics and support teams that could work with them to improve their well-being, many would take advantage of it. I pointed out obesity, which is 43%, and that's not overweight, that's obesity. Those folks want to lose weight. There are many reasons they don't, but part of the reason they don't is they don't have support teams built around them. They don't have lifestyles advice that they can implement into their life day in and day out. For anyone in this committee who was able to go running or exercising for 20 minutes yesterday, you probably did the equivalent of reducing $100 billion of expenses for Medicare and Medicaid just by being active. If Americans would do that every day, that's what we'd experience, but we haven't done that. One tactic that I believe will work quite effectively is if we can get real-time information from physicians and other health providers taking care of patients, and using that real-time information, give feedback to people who are worried about their well-being. That's when they're more likely to use that advice. That tool would allow them to both call an expert if they needed that resource. We'd provide them tools to do that. We'd reimburse some of the healthy lifestyles that would be generated by these interactions, and we'd make them an active participant in their well-being. I think that dramatically changes the power dynamic. It makes the American people feel like they actually can be the world experts on their well-being.
Thank you. I very strongly agree with your focus in these comments on lifestyle-based interventions that can actually help people help themselves to get much more healthy. And I'm also interested in how you might reform our payment programs to become more efficient to serve both patient lives and to save both patient lives and taxpayer dollars.
So when I sat with Senator Wyden last night, he asked about a similar issue, which is pre-authorization. We spent about 12% of the CMS budget on bureaucratic processes, the administration of the program. And most of that money is taken by middlemen in ways that I don't think need to be true in the long term. I believe we have the power right now with technology that didn't exist even 3 or 4 years ago to automate a lot of these processes, and pre-authorization is a good example. There are about 15,000 procedures that go through pre-authorization. Insurance companies in aggregate probably have 5,000 they'll list, but they only have to have about 1,000 in order to truly make a difference and make sure that the right procedures are done in the right way. We should be able to create an experience for physicians and patients so that we know almost immediately if what they're going through is requiring a pre-authorization, and if it does, what do they actually do to qualify for it? That could be instantaneous. By doing this rapidly, we cut out several % of administrative costs, deal with the intense frustration the American people have with pre-authorization, which was raised by many members of this committee, and we actually improve the care of people without costing or taking money out of the system. Those are the kinds of advances I believe we can champion.
Thank you. That concludes my questioning. We have a vote on, and so I'm going to step out and go vote. That's probably why you've seen a number of the members slip out. Senator Wyden will go next, and then Senator Grassley, and hopefully I'll be back by then. So thank you.
Thank you, Mr. Chairman. Dr. Oz, I was listening carefully to your remarks, and you talked about cherishing Medicaid. And I think that's a very good sentiment. So I want to ask about how we're going to do that. Will you agree this morning, since you want to cherish Medicaid, to oppose any cuts to the Medicaid program? And I want a yes or no, because we all agree that we need to do more to fight fraud and such matters. But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
I want to make sure that the patients today and in the future have resources to protect them if they get ill. The way you protect Medicaid is by making sure that it's viable at every level, which includes having enough practitioners.
Well, you've been listening to Senator Ron Wyden, a Democrat of Oregon, starting his questioning to Dr. Oz, who has been nominated to oversee Medicare and Medicaid. He is expected to probably be confirmed, but we expect some fireworks, especially from Democrats, in this confirmation hearing. We're going to take a quick break, but we'll be back with more after this. Well, happening now, we're going to go back out to Capitol Hill, where senators are questioning Donald Trump's pick to oversee the Centers for Medicare and Medicaid Services, Dr. Oz. Let's take a listen.
Are allowed to see the records, and they can only read the records.
I've got one last question. Do you believe in a nursing home there should be a registered nurse available around the clock 24/7? The reason I ask this is because that is the rule that is coming up, but there's going to be an effort to roll it back. So do you think we ought to have nursing homes without nurses?
Senator Wyden, as you know, it's a complicated question.
No, it's not. We need a nurse in a nursing home. Not too complicated.
I actually think we need a nurse who will work in a nursing home. And in many nursing homes, that's become a problem. So I believe we can provide quality of care equivalent to having a nurse in that nursing home using tools and technologies, including telemedicine. I want to be flexible enough so that we deal with a massive crisis that we spoke about briefly yesterday, that we have a lot of people aging. In the opening statements, it was pointed out that we're going to go from 68 million people on Medicaid to 90 million people on Medicaid over the next decade. So I want to ensure, and if it's confirmed, I would like to focus on this issue, dealing with older people.
My time has expired. I would only say that right now the proposal gives rural communities 5 years to come into compliance. So I think we can get this done. But if you're confirmed, I hope you won't take the nurses out of nursing homes, because there's going to be an effort in the Senate to do that, and I'm going to be opposed to it. Senator Grassley.
I've got 6 issues, no questions. At the end of my issues, you can either agree or disagree or not say anything, whatever you want to do. I've been working to hold pharmacy benefit managers accountable to lower prescription drug costs. I expect you to work with us to hold these powerful drug middlemen accountable and support rural pharmacists. Last year, there were at least 3 bills introduced on pharmacy benefit managers, with a total of about 65 senators. So this is a big issue in the United States Senate. On rural health care, I expect you to protect and support access to rural health care. To help achieve this, I believe CMS should take the following actions right away: fill the open slots in the Rural Community Hospital Demonstration Program, distribute the new physician residency slots to rural hospitals as the law requires, ensure that Rural Emergency Hospital Program, which is a program I got passed 5 years ago, is working for rural communities. I've had a big interest in kids with exceptional needs. I expect you to take action to improve care and reduce red tape for kids with complex medical needs. This includes working with states so that they can establish health homes for these kids, as my bipartisan ACE Kids law enabled. Transitional health plans is the 4th one. Since 2013, CMS under President Obama, Trump, and Biden have issued what's called non-enforcement memos to allow transitional health plans to be maintained. About 35,000 Iowa farmers and small business owners have maintained these health insurance coverage with these plans over for over a decade. This is the health insurance that was purchased after Obamacare became law.
You've been listening to the confirmation hearing for Dr. Oz. He would be in charge of Medicare and Medicaid services. Obviously, a lot of talk about Medicaid, specifically on Capitol Hill right now, as Republicans mull potential cuts to the program for Donald Trump's budget priorities.